All right, so I will get started. Welcome to the Taussig Nutrition and Culinary Medicine program, and thank you for coming today. Today's session, we will be talking about cooking for your loved ones during treatment. First, a few housekeeping items. Please have your microphone silent and place yourself on mute until we enter the question and answer portion. And please direct your questions to the chat, and we'll answer those questions at the end of today's presentation. The goals of today's program is to help cancer patients, survivors, and their families navigate cooking during cancer treatment, to increase confidence in the kitchen, and to answer nutrition and culinary questions with evidence-based explanations. We will begin with a brief nutrition discussion by myself. I'm Lisa. I'm one of the dietitians at Taussig Cancer Center. And then we will get into the recipes and cooking with Chef Jim and Chef Gabby. Again, please silence your microphones. We are recording the program today and want to ensure the recording is free of extra noise so that others can watch. So when you're healthy, eating enough food to get the nutrients and the calories that you need is usually not a problem. But when you're being treated for cancer, these things can be hard to do, especially if you have symptoms or side effects that impact your eating or you're just not feeling well. Good nutrition is especially important if you have cancer, because both the illness and its treatments can change the way you eat. And good nutrition during cancer treatment can help you to feel better, keep up your energy and strength, maintain your weight and your body's store of nutrients, better tolerate treatment-related side effects, lower your risk of infection, and help you to heal and recover faster. So, in regards to cooking for your loved ones during treatment and caregiver support, preparing meals for a loved one with cancer is an important and caring act that can be frustrating at times, because people with cancer may not feel like eating, or they might feel full after just a few bites, or certain foods that they once loved, they just might not have a taste for anymore. And caregivers often view food preparation as an expression of love. So I'm going to go into some meal planning tips that can help caregivers who are either preparing meals for their loved ones, cooking meals, or branching that task out to others. So we want to offer food often and provide a variety of choices. Again, there's going to be times where a person's likes or preferences or things that they enjoy eating might change on a daily basis or sometimes an hourly basis. Sometimes people may be hungry in the morning or have an appetite for something in the morning, and then come evening, they just don't want to eat. So make sure that you are offering food often and providing a variety of choices. You also want to take advantage of the times when your loved one feels hungry. Oftentimes, we do hear that patients feel the most hungry right when they wake up. And that's when we want to emphasize, okay, let's get the calories and protein and a lot of good nutrition in during that time. That way, when the day goes on, if the appetite waxes or wanes, it's okay to not push it, because your loved one has gotten a good amount of their calories and protein in earlier in the day when they feel the most hungry. We also want to have nutrient-dense snacks readily available. And nutrient-dense snack examples can be anything from like apple slices or bananas and peanut butter, crackers with hummus or cheese or peanut butter, hard-boiled eggs and toast, or tortilla chips and guacamole, etc. We also want to stock up on high calorie and high protein supplements. So these can be your Boost or Ensure supplements. These can be any kind of protein powders, Fairlife, Orgain, Kate Farms, Carnation Instant Breakfast, any of those supplements that your loved one can grab and go or sip on throughout the course of the day to ensure that they're getting their calories and protein in. And be willing to modify the diet if nutrition impact symptoms arise. So these symptoms can be anywhere from nausea, altered appetite, taste changes, constipation, diarrhea. And in those instances, certain diet modifications might need to be in place. You could also consider asking your loved one to make a grocery shopping list so you know exactly what their desires for or what they are looking forward to eating. Um, you can organize a meal train. There's a lot of different apps or websites out there that you can organize a meal train with other family and friends that can, set up, okay, I'm going to cook a meal for my loved one on this day, and then the next day someone else is going to take it. And that can be a really good way to help out um, while also having others contribute and help out as well. We also want to be careful with information you find online. If you search diet and cancer online, you are going to find a variety of information out there that a lot of it is untrue or not evidence based. So just really be careful with the diet information you find online. And as always, asking to speak to a registered dietitian for any additional help that you might have. These are some tips to increase calories. So, like I said before, good nutrition is important when someone is going through cancer treatment. And if you are the caregiver that's either preparing food or making or serving the meals, these are some tips to kind of sneak in extra calories where you can. So, you can add butter or olive oil to bread, potatoes, vegetables, or soups. You can use generous amounts of mayonnaise or another higher calorie condiment, salad dressings, or nut butters. We can choose higher calorie drinks such as whole milk or, if you're lactose free, like a lactate whole milk versus a non fat, lower calorie option. And adding avocados, nut butters, chocolate, cream, or half and half for extra calories and extra flavor. In addition to calories, protein is going to be important. Protein helps our bodies to heal and fight infection and help maintain our strength and our muscle stores. So, protein is another important nutrient aspect to keep in mind when someone is going through treatment. So, ways to boost the protein in foods or meals served is, keeping hard-boiled eggs on hand in the refrigerator, and you can use them to make egg salads or add them to salads, casseroles, or soups. You can add grated, sliced, or shredded cheese to potato soups or sandwiches. And you can also add cottage cheese or Greek yogurt or nut butters to recipes. Greek yogurt is a good substitution for sour cream, and it's going to add some additional protein in. Cottage cheese is on the rise now as a trendy addition to, pasta sauces, or people make them with their scrambled eggs to add additional protein. So all of these can be ways to help incorporate some more protein in the foods and meals served. There's a couple sites for online recipes that I've attached on this slide and the next slide. So this one is from MD Anderson, and the reason why we always recommend this one to our patients is it goes through different topics that your loved one might experience and recipes that pertain to that specific symptom, or if someone has texture issues or taste changes, they're going to be drop downs that you click on, and there's going to be specific recipes for if you need soft textures or if you're looking for something that's a more sweet taste or salty taste. And the symptom related recipes, if your loved one is experiencing nausea or taste changes or constipation or things like that, the symptom related recipes are going to be specific to that symptom that your loved one is experiencing. So, this is a great resource for recipes that pertain to certain symptoms that your loved one might experience while going through treatment. These are also two Cleveland Clinic online recipe sites. One is from Wellness and Preventive Medicine, and the other is Health Essentials. So you can find a lot of great recipes on these two websites as well. So the recipes that we'll have today are chili mac, sloppy gems, turkey chili, and a pecan crescent cookie. So at this time, I will stop sharing my screen and turn things over to Chef Jim and Chef Gabby.
Okay, thank you, Lisa. Can we pin this? Yeah. So, I'm Chef Jim. This is our sous chef Gabby. And so we're going to begin doing these recipes. Okay, so hopefully you could see. All right, and here. Okay, so first one, we're going to do a turkey chili. Okay, and it's going to be not just turkey, it's going to be made with cauliflower. And we take the cauliflower and we rice it. So you could buy rice cauliflower already done in the store, or you could get a whole head of cauliflower that you could use for from making a cauliflower cream sauce to roasted cauliflower. But I'm going to show you a couple ways to rice it. So the harder way would be taking a box grater and you would just go on the large hole of the box grater. And by doing that, you take this large chunk and now you got these little pieces, right? Or the easier way to do it, if you have a food processor, you just take the cauliflower that's measured out, the amount that you need, you put it into your food processor and then just pulse it, and within 15 seconds, you got rice cauliflower. And you could overdo it. So you don't want to do it too much. And you could see right here, look at that's it. We're done. Okay, so here's our rice cauliflower. You could see what it looks like. It was that fast to do, right? So you could actually do your own. I'm going to set this here. So you got two options there to do it. You could also do it with a knife, but that would even be worse than the grater. It would take you more time. So now once you have your cauliflower rice, we just take it, we put it in a pan, we brown it a little bit in olive oil, and you could see what it looks like. So see how it's a little bit golden now and it looks crumbly? Well, what this did, it sweetened it, right? Because cauliflower is a cruciferous vegetable. And a lot of cruciferous vegetables have like a sulfur content. That's why when you eat it raw, it's not, you don't taste the naturally occurring sugars, the sweetness in it. But when you toast it in the pan like that, you caramelize those naturally occurring sugars. This becomes sweet and it's really good. Okay, so we got that in a bowl. Then we took onions and small diced onions and green pepper. And what we did was we already pre-sauteed them to save some time. So you could see we just want to get the onions at least to the point of translucency. And if you want to put a little golden color on them, you can, and they'll just become sweeter as well. So we did that. Okay, so now we got our pan is already warm. We heated it up. We got our cauliflower that we're now going to put in with our onions and green pepper. We're going to add some garlic to it. Okay, we got our garlic and we're going to let this cook for a little bit. Okay, just to get the garlic to the point where it's aromatic. Okay, and you could add more oil if you think you need to, but we got plenty already in the pan from sauteing the vegetables. Okay, so now we got 99 lean ground turkey. So while this is on low, okay, we'll talk about turkey. All right. So what we did was we bought 99 lean because it'll have less fat, it'll be less greasy. Sometimes if you get whole ground turkey, you got a lot more saturated fat, but sometimes that could, when things are greasy, or it could maybe people could get nauseous from that as well. So by using 99 lean, not only do you minimize the saturated fat, you also, it's not as greasy, and that could be appealing. The other thing is we got this on ice, so you always want to keep it cold. So I'm going to put that there. And then the other thing to be very mindful for, that whenever you never want to touch this if you can, because if you touch the raw poultry and then you go to touch a glass of water or something or whatever you would touch, you would cross contaminate the surface of whatever it was you touch. So ideally what you want to do, whatever you have your turkey in, you'd want to try to take it out and then we're going to put it into the pan like so. And then that way we're not touching anything else, okay? And then you would wash or discard whatever that turkey was in. Okay, so now what we're going to do, we're going to turn up the heat. Our raw turkey's in here, but now we want to break it up because if I just cook it like this, it'll be a lump, and I don't want that. So what we need to do is we just need to break this up, okay, like so. And I got the heat turned up a little bit. Now, the thing that's also going to help here is by having these peppers and the cauliflower in here, as I go to break it up, they're already warm. So they're going to start to cook the turkey as well. Okay. And as I go to break it up, it'll help break it up, right? That means the turkey won't stick together as easily because it's got the pepper and the cauliflower and the onions in between it. Okay. So as now I got my seasonings, right? And I'm going to put the seasonings on the turkey. While this cooks, I'll reach you what the seasonings were. We did our own turkey seasoning. Okay, so I'm going to put that on our own chili seasoning. And I'm going to ask Gabby to help break this up while I read the seasonings because it's on a hot flame. Okay, so if you go to buy a chili mix, right, for chili, sometimes it could be really hot. They'll have a lot of, cayenne pepper in it or other types of pepper, and they could be spicy, and that could, be off-putting to some people. So this is a great recipe to make your own, chili seasoning mix, and you could control the amount of salt or heat that goes into it. So you'll have the recipe for this, but it's got 2.5 teaspoons of chili powder, 1 full teaspoon of cumin. We put a half teaspoon of salt in this seasoning mix, but that is optional. So you could control that. A half teaspoon of black pepper, also optional that you could control if you want less pepper. And then a 1/4 teaspoon of paprika and a 1/4 teaspoon of oregano. And this will last easy 3 months if you just kept it in a cool, dark place, covered like in a little container or a jar. Okay, so now we're back over here. All right, and then while Gabby's doing that, we're going to cook that. Then we got some low sodium V8 juice that we're going to put into our chili, and that's going to be our sauce. Now, once I put this in, so Gabby's breaking it up. Now, right now it's a dry pan and a dry heat. As Gabby's breaking that, it's still toasting that cauliflower and the peppers a little bit more. Once I put this juice in, it is now going to add humidity to that pan, and that turkey is going to cook even more quickly, right? Because now this will get hot and that'll cook. But so now you can hear maybe this pan sizzle, and we got all that in. So now it's really loose, okay? But it's going to tighten up because it's going to start to evaporate. The moisture will evaporate. As it does that, it's going to reduce down and concentrate all the flavors. The good part about this being loose right now is that everything is infusing now. All the flavor from that caramelized cauliflower, the caramelized onions, the green peppers, and that turkey. Now you got juices from the turkey that came in here. Now you got this flavorful liquid. It was already good because of the V8. Now it's going to start to reduce down. So now what we have an option here. Okay. The turkey's pretty much cooked now. It looks pretty good. This turkey is cooked. So we're going to turn this down just a little bit. Okay, like so. So now this is a decision you would make on how you would like it. Right now it's a little bit on the loose side. You could continue to cook it a little bit more to tighten it up if you want a drier chili, or you could keep it loose like this. And Gabby's going to show you this on the next recipe. Okay. Let's say you want to have turkey chili one day, right? And right now it looks really good. So if I take some of this, and you could actually, Gabby, maybe turn the heat down. You could turn it off now because we're beautiful right here. Okay, so I'll show you real fast here. Here's what we got. Here's our turkey chili. Okay. And this is what it looks like. Gabby just said it smells good. Okay. Here's our turkey chili. But let's say you got some leftover. On the next recipe for the sloppy jims, we're going to show you how to make like a chili mac, but you could do the same thing with this one. So if you had this here like so, you can actually take some of this pasta, if you got any type of pasta pre-cooked, and then we could just put a little bit of pasta in the pan like that, right? And we mix this in like so. And now you got a chili mac. So that's when you, if you know you want to make a chili mac for sure, you can always add a little bit more juice. And I'm going to put the chili mac on one side, the straight chili on the other side. And now you could see both sides on what that'll look like. All right. Wipe the edge of this plate. And here we go. So you could take the plain chili, but if you got leftover, you could turn it into a chili mac. Okay. And that's a way to repurpose your leftovers, or you could even plan that when you go to do your shopping, how to have a primary meal and a secondary meal, right? So that's our first recipe. Okay, so now our second recipe is going to be one we called sloppy jims. It's my spin on sloppy joes because we're not using beef. Generally, when they would make sloppy joes, they would use like an 80-20 ground beef, right? Instead, we're going to use a 99 lean ground turkey. We're also going to use more convenience products that you could purchase and buy. Example, one of them is ketchup. You could just get a ketchup that's low in sugar as well. So now I'm going to hand my headset over to Gabby, and we're going to let Gabby explain this one to you. Okay, take it away, Gabby.
All right. Okay, I think everyone can hear me. Should be good. Yeah, so just like Jim said, you have your regular sloppy joes that you would find from a can. This is just a healthier alternative that Chef Jim created. So sloppy Jims, here we go. So just like it's very similar to the recipe we just did too. So just a couple different ingredients. We have some onions and some different peppers. We have green peppers and then some red peppers in here too for a little color. So we cut them nice and small, teeny weeny tiny and small, because that way when we infuse all these other things together, you're going to get a little bit of everything in every bite. And that's a culinary technique that we like to share with a lot of our recipes. When you cut things smaller, it helps with your digestion, all kinds of things. So I'm just heating this up a little bit, and I'm going to add some of our favorite fresh garlic. I have about a teaspoon here. And I'm just going to try to incorporate this into my peppers and onions, really get that aroma going just for about a minute. I don't want to overcook my garlic, but we just want to perfume and make sure it smells nice and good. So we're going to add that here. And then Jim he talked a lot about the turkey, but just like instead of using something with saturated fat, like a classical, you'd have like a beef sloppy joes, we're going to use 99 lean ground turkey again. Where did my turkey go? Okay. No. Where'd my turkey go? Oh, okay. So now I'm going to add my turkey and just get that nice and chopped up, just like Jim did with his last recipe. And again, we had things on ice. We want to make sure we are working on to prevent cross-contamination. But we're just going to get this nice and brown, break it up just like I did before. And you can see how lean this is. I mean, it's nice and pink. There's not a lot of saturated fat in here, but you're still getting all that protein and added calories if you want when you're trying to make this. And so we're going to show you again, Jim said we're going to make like a chili mac. So we're going to add pasta to it and a couple other ingredients. But then we're also going to make it classically just like on a sandwich with some whole grain bread. And so I'm just going to keep chopping this up. And try to incorporate my peppers as well as some of my spices, just like Jim had. So I have a little bit of salt, pepper, and thyme that we're going to add just for extra flavor. You can add whatever spices you like too. If you really, want some paprika in here or something. We're gonna add some cumin when it comes time for the chili mac as well to add a little extra flavor as well. So I'm gonna add my salt, pepper, and thyme. And make sure this just keeps cooking. We wanna make sure we are nice and cooked fully. And again, I'm just breaking up and chopping this. So anytime, helps to have the right tool for the right job. So we have a spatula that's it's got like a nice sharp edge, it's kind of something that you really can dig in there and cut almost. Oh, thank you. And we are almost there. So it'll take really quick and you can overcook it in a heartbeat. That's why, it's so lean, right? So we are almost there. I just want to make sure I don't see too much pink. And then the other convenience product that Chef Jim mentioned, we are going to add a little bit of ketchup. We have about a half a cup. And you just want to look for a ketchup that's less than 2 grams of sugar per serving. Heinz makes one, I believe, and then some other brands do as well. We have some Grey Poupon or Dijon mustard, so a little bit of that for like that tang in there. And then we have just some rice vinegar. Again, to add a little acid in there. And then Jim, I think, will probably talk about raisin reduction with the cookie, right? But we are going to add raisin reduction just as a little bit of a natural sweetness. So it's using raisins, a natural sweetener that has protein and added fiber in there rather than using like honey or maple syrup or something like that. Do you want, go ahead. Oh. Okay, I need a bowl then. There you go. Thank you. I just need to get a bowl. And then, so Jim was just saying that if we want to speed up this process, when you have just like he did in that last recipe, he added, some of that tomato juice that helped it cook as well. That's what we're adding a little bit of water in here just to keep it all cooking nice. And so we're almost there right now. But then what I'm going to do is I'm just going to mix all of my other wet ingredients. Thank you, Jim. I'm going to mix all of these. I'm going to put this down a little bit, actually. There we go. I'm going to mix my ketchup and my mustard, all of the wet ingredients, just to make sure I can infuse and kind of mix it up easily and, make it all even. The water already evaporated, Jim says, in that pan. So now I have my mustard in here. And then we're going to add a little bit of rice vinegar and some raisin reduction. That's going to add a little bit of sweetness. And then you can see, so I'm just mixing this up just to make sure we infuse it all together. And then we're going to add this into our pan. All right. Yeah. Okay. And then, so Jim's telling me I am going to bring up this pan just so you guys can see. So we weren't able to feed in on the other one, but you can see how nice and broken up it is. Sorry, I'm short. But you can see how nice and broken up it is. It's nice and nice, small pieces, and it mixes well with those small diced peppers, right? And it's nice and, pardon? And the water's all gone. So now, and that just helps speed it up a bit. So now we're going to add our ketchup mixture here. And this comes out just like a sloppy Joe, but it's a sloppy Jim. And I'm actually gonna use this guy. Get all that sauce out. All right. And so we're gonna mix this first, and I'll show you just kind of how to, make a classic sandwich here. And then we're gonna add whole grain pasta and turn it into a chili mac. So, you've got all of these options to make a good meal at home. Maybe you have sloppy Jims one night, but then the next night you made extra. You can turn it into chili mac 1 or 2 nights later, right? So now I've got, oh yeah, this is good. So I'm just going to take a little bit of this. We just have a little bit of bread here. And this is a whole wheat, uh-oh.
Right.
Sorry, I don't know what it's doing. Oh, okay. I am sharing this dog toss. Okay, sorry. So this is a whole grain, 100% whole grain bread. Get a spoon. I'm just gonna put a little bit on top.
Then I'll show the thing when you narrate it.
Thank you.
And you can add more.
Yeah, and you can add more if you want. We've got just a little bit because we want to save some for our pasta. But you can. So now we have a sandwich. Again, nice and filling. And here we go. We're gonna make or turn this into our chili mac. So all we have is we have some cumin. I'm gonna add a little bit extra spice in there. We have just a can of crushed tomatoes. So this one has no salt added, but just a little bit of crushed tomato product in here, just to give some more of that, make it looser before we add all of our pasta. And I'm gonna let this cook a little bit too, just to kind of make sure it infuses well with the other ingredients. And then I think Jim's gonna show you, that's a box of the whole wheat pasta. So we're just using rotini, but you could use whatever shape you like. We just always recommend 100% whole grain, or if you need gluten-free, you can find plenty of options there. Chickpea pasta has good protein, things like that. If you're looking to increase more protein. And then this is totally optional. We have some hot sauce here. We like to use Cholula, and Jim's going to show you. It's, really good flavor. It's not too hot, but it's really big and bold on flavor. So again, totally optional if you're maybe not interested in, or you can't handle a lot of that spice, no worries. But just to give it a little something extra, I'm going to do that. And I'm just going to keep rotating this. And, pan skills are really important as well. So I can easily mix this together just by going counterclockwise and clockwise, and even, maybe not. Sometimes with the liquid, you don't really want to flip it. But you could see before, it helps keep things moving, keeps things going quick. And this is nice and thick now. Just for the sake of time, I'm going to add some of our pasta. And we're going to go from there. So now I'm gonna make sure I mix this all really good. And I have a bowl to show you. But so you've got a few different chilies, different ways. I believe both of these easily freeze, right? So you can easily freeze these, make a couple of batches and have, on hand for when you need something quick just to thaw. If you were gonna make this into a chili mac, I wouldn't freeze it with the pasta. I would, do that separately. Freeze the sloppy Jims first and then add the pasta when you take it out. And I'm just gonna put this in a little bowl to show you. And voila. And then I think last, we're gonna make a cookie for your holiday table. And let me just wipe this off here. But these are two really easy ways to make something healthy for you guys. Have this for lunch or dinner. And yeah. And so now, got a nice hearty meal there. And I'm gonna give Jim's headphones back. There you go.
Thank you, Gabby. So as Lisa was saying about earlier, talking to increase your protein. So when you, with that 99 lean ground turkey, there's 26 grams of protein in 4 ounces of that. Plus, then you also had protein in your whole grain pasta as well. So there's 8 grams of protein in a 2-ounce serving of this pasta. So you got a fair amount of protein, and you could probably even bump that protein up more. If you wanted to, you could even add walnuts to that. Why not if you wanted to increase protein? It would give you a crunch as well. Okay, so now we're going to do a cookie. And what we're going to do is we're going to show you how to make a crescent. But then what we did was after the cookie, I'll show you how to do a elf shoe napkin fold for your holiday table. And then we took the same crescent cookie and we turned it into a candy cane. So instead of putting a real candy cane in, this is a healthy whole grain with no butter, cream, or eggs. And we put that right into our napkin fold. Okay, so to make the cookie batter, first we start off with toasted pecans. Pecans are sweeter. You could probably do a combination of pecans and walnuts if you wanted to. But to make it sweeter, we're just going to use pecans. And for 13 seconds, we're going to pulse this because we don't want nut butter. We just want to get a nice coarse nut meal. So I'm going to do that for 13 seconds, right? And I'll show you what it's like when it's done. 3 more seconds to go, and we are good. So this is what we got, see? So we got this beautiful, you could see right there, we got a nice coarse ground nut meal. We're gonna grind it up some more. We're gonna add 100% whole grain flour. This is whole wheat flour. Okay, we're gonna put that in as well. And if you wanted to make these gluten-free, you could use a gluten-free flour as well if you wanted to. Okay, and we're just gonna mix that in, pulse it. Okay, now it mixed in with the nuts. But now what we want to do is we need to get a spatula. Can I get a clean spatula to scrape the sides of the bowl, Gabby? And so we want to just scrape the sides of the bowl like this, because sometimes thanks, Gabby. What happens is sometimes those nuts, when you go to grind them, as the oil comes from the nuts, they'll stick to the side of the bowl a little bit. So now that flour, I'm just going round the edges, all I'm doing, just like that. Now we're good. And I'm going to pulse it again real fast. There we go. Now we're good. And all that's in here, now I could show you, it's just flour and nuts. See? Okay. Now we're going to add a little bit of salt to that. Okay. In our cookie, we'll give that a quick pulse. Okay. Just to blend it, mix it. That's good. Okay, that goes in. Now we're going to add our wet ingredients, okay? So what we got here is I got some unsweetened almond milk, all right? I'm going to put that in. And when we use the almond milk, okay, I'll let Gabby take these up and show them to you. We try to buy it where there's only 3 ingredients. So one is almond milk, the other one is a Khalifa, and the only thing in there is almonds, water, and salt. So it actually has more protein than if you buy like Silk or almond breeze or something like that, because there's more almonds in there. Right. Okay. So now we got our almond milk in there. We got a little bit of vanilla. Okay. Now this is our raisin reduction. So when we've talked about this in the past before, all it is raisins and water. So if you took equal parts, 1 cup and 1 cup, or 2 cups and 2 cups, and you put them in a pot, you cover it, you reduce the heat down and let it simmer for 15 minutes, that cup of liquid will reduce down to about 3 tablespoons because the raisins are dry. What they're going to do is rehydrate and suck up that water, but they're also flavoring it. And then when you'll end up with is about 3 tablespoons of this like a raisin bouillon or broth, okay? And then you put that in a blender. You just blend it and it comes out just like this, like baby food, right? Oh, it looks like kind of like pudding, okay? So and it freezes really well. Yeah, Gabby will get one out of our freezer. She'll show you. So we usually make a double batch. It freezes great. And you could even scoop it out when it's frozen, kind of like you can ice cream, right? And that way it'll last easily for 3 months. So we just freeze it a 2 cup like that. That's our raisin reduction. Okay. So what I'm doing now is I got, right, that goes in there like so, the raisin. Now last, I got a little bit of oil, okay, that's going in. So we put our oil in there, and now what we're gonna do is, I just wanna mix this in, okay? This way I could get a good infusion, because if you just put those in separately, they're not gonna mix as well, right? And now I'll put this in and I'll let you see what we got here. Look how nice when you do this just like this. Look at that. It's all infused. So basically what we did, we emulsified the vanilla and the raisin reduction into that oil is what we were doing. Almost like if you wanted to make a salad dressing, right? Okay. So now we're going to put our processor on, and I'm just going to take our ingredients and it's going right into our processor, just like that. And this is going to make our dough. Okay, it's starting to ball up, as you could see. There we go. Up, it's already balled up. Look at that. All right, there we go. Okay. So, and there's our dough. Now, you could have taken the dry ingredients and the wet ingredients and put it in a bowl and done it by hand. But then right before I logged on, I was thinking at the last minute, let me try to show you guys an easier way. So there's some that didn't get mixed in. So now I'm breaking this dough up and I'm spreading it around to get this pieces that didn't get mixed in, right? Pulse it. There we go. Now we're getting it all. And that's what I want. And now we got our dough. And that's what we're looking for right here, okay? Now, if you think you want to make it looser, you could add a little bit of water to it. But that could make it, you want to, depends how loose you want it to roll it out, okay? So now we got our dough like so. I think this one here, I might just add a smidget of water. Not a lot. Okay. So I got this pulsing. That's enough, just a little bit. There we go. Because you want it to ball, right? That's what I'm looking for. I want that ball. So if it, you want to add just yeah, I probably got maybe a teaspoon of water I put in, a teaspoon and a half, because this is what we're looking for right here, this ball. That's what we want. Okay, so now we take this out. Okay, that goes in like so. Scoop that. Set this aside over here. Okay, and here's our dough. That's what we're talking about. Right here. And that's it. That's our cookie dough. Okay. So now we're going to set that over there. And we take a pan like so. So this is a half baking sheet. Okay. And then we just got a scooper. And so now you could just take it and make scoops like so, right? If you want to make a crescent, you'll roll it out. Okay. And I'm just going to show you real fast. So to make a crescent, you would just take it, you roll it out like so. And then once it's rolled out, you could just bend it into a crescent shape and you bake them like we did. Or Gabby and I were just talking this morning about doing other shapes. So you could make a thumbprint cookie just like so, and then bake this off. And then you could put in a type of jelly if you wanted some more moisture, more flavor, or a nut filling, right? And so we were kicking around this morning coming up of some other recipes what to put in for a filling. So that'll give you that idea. But then you would just bake this 13 minutes at 350. And after you do that, what happens is you get a great, nice cookie that when you break it, I'll show you what it looks like inside. right? Look at it, it's nice. 13 minutes. It holds its shape and form, but it's not too dry. And it's definitely not too sweet, right? A great cookie. You could add cinnamon to it if you wanted to flavor it some more, or you could even add ginger if you wanted to take on like a little ginger snap thing going on. So you could do that now, or you could turn it into a candy cane shape and bake it, whatever shape you want. Okay, and so lastly, just wanted to give you a little holiday gift, okay? And so what we're gonna do is we're gonna do a napkin fold. Oh, thanks, Gabby. Okay, we'll just wipe this off. And so you have this on your handout on how to make an elf shoe napkin fold, just like so, okay? So basically what we did, we took a full napkin. And if when you were a kid, if you ever made a paper airplane, it's the same way. So if you did make paper airplanes when you were a child, I'm going to take you back to your childhood, so to speak. Okay, you fold it and the open end is towards you, right? Then you take it and fold it one more time, just like a paper airplane, open ends towards you. Finger in the center, fold one side down, fold the other side down. Looks kind of like a house. We take those two, we fold each half inside, inwards again, like making a paper airplane. And now you have this triangle, right? Then you close that gap, just like so. Flip it over, top fold goes up, and the bottom fold gets tucked in to the point, the fold that's in the tip of the point, just like so. You fold that in, bend the toe, and you have an elf shoe napkin fold just like that. So we got Dr. Umeda coming up. We'll hand it over to him. We hope you enjoyed these recipes. Always think about how you could repurpose leftover recipes, or even when you're planning your shopping list, how you could think about what you could do with the leftovers or buy ingredients for that. Hope you enjoyed it. We could take any questions at the end, and now we'll give it to Dr. Umeda.
Okay, so, oh, right. Jim and Gabby, thank you for your presentation. So everyone, nice to meet you. I think most of you, it's the first time to see each other. So my name is now Dr. Umeda from the Wellness Department, Integrative Medicine. I'm a staff physician here. I just wanted to have a 3 minutes presentation to talk about what is the integrative medicine for the cancer care. So let me prepare the slide, share with you. Give me 1 second. So I assume you can see the once. I have only one single slide. I think you can see the full screen. If you cannot, let me know, please. Maybe some of you already heard about the integrative medicine or also called integrative oncology. So the integrative medicine is a patient-centered, evidence-informed field of the comprehensive cancer care that uses lifestyle modification, mind-body practices, and also natural products alongside with the conventional cancer treatment. So our role is to do something supportive, physically and mentally during your treatment, or even before your treatment, during your treatment, or after the treatment, which is the cancer survivorship. And as you can see on the left top corner slide, the example of the cancer center with the large integrated medicine services, for example, MD Anderson in Houston, Texas, Memorial Sloan Kettering in New York, Dana-Farber in Boston, cancer treatment center of America in the multiple big cities in America. So they have the integrated medicine services. They have physicians like myself, and also acupuncturists, nutritionists, dietitians, massage therapy, mind body work, holistic psychotherapist, meditation specialists, like that. And also they have a multiple program, such as you can see on the right upper corner: nutritional counseling, yoga program, meditation, exercise, chiropractic, hands-on treatment like massage, and also acupuncture. And sometimes we get a question like, what is the appropriate use of the vitamins, like a vitamin D or any other vitamins or natural products. Especially those people are on the chemotherapy and or immunotherapy or any hormone medicine, such as for the breast cancer or prostate cancer. We have to be very careful about the possible drug herb interaction or drug supplements interaction. We have to always avoid that. So one of my role is to sort it out. This is good to do, not good to do. This is safe to do. This is not safe to take, like that. Because there are so many information on the internet, like what is any like a beneficial over-the-counter supplements in your internet. There are so much confusing information. So sorting out the information, this is one of my role. If you see on the left lower corner, the growing evidence for the cancer patients, there are multiple literature and the research data that for the chronic symptom, for example, pain or fatigue, insomnia, anxiety, nausea, vomiting, neuropathy like a numbness, tingling, hands or feet, dry mouth, hot flashes. For each bothering symptom, there are multiple research data proven to be effective, or I would say worth trying. And everything is safe to do, whether you are on the active chemotherapy or after the chemotherapy or immunotherapy. So for example, if you have chronic pain, whether neck pain or headache or back pain or joint pain, hip pain, acupuncture could be beneficial or worth trying. Massage therapy could be good to try, or even combination with the meditation, it could be worth trying. Fatigue, exercise, yoga, acupuncture might be good. For the neuropathy, acupuncture, massage therapy might be worth trying. Yeah, so we always do like an evidence-based or data-based approach. So that's what we discuss. When we do the one-on-one appointment, we will talk about that. So this is really the brief explanation for those if you never heard of the integrated medicine. So I wanted to share with you what it is. As to the contact information, if you have questions or special requests, please reach out to me. On my office phone number is 216-448-4325. If you have a specific question, like a discuss in detail one-on-one, I'm happy to do that. I see non-cancer patients such as, let's say, headache or migraine, chronic pain, back pain, irritable bowel syndrome, anxiety, depression, really variety of condition, non-cancer disease. But also I see the cancer patients very frequently, especially collaborating with the cancer specialists, cancer providers, and all, including the nutritionist, dietitian, and also palliative medicine doctors. So I do the clinic at the main campus, Towson Cancer Center Institute, only once a month, although it's only once a month, but first Monday of each month. Mainly, I'm at the Beechwood Family Medical Center of the Cleveland Clinic from Mondays to Friday, almost every day. And also every Wednesday, I do the virtual. But if you want to do the virtual, I can do it in Monday or Tuesday or Thursday, Friday. So whether Beechwood or virtual or main campus, I'm happy to do the more discussions. you don't need a referral for the oncology. You can ask your oncologist to put the referral order, but it's not always necessary. If you want to just call us and you can make an appointment, but then after that, whenever necessary, I can contact your oncologist or surgeon or radiation oncologist or psychologist or psychiatrist whenever needed, and including the palliative medicine doctors. So again, always choose something to do safe or something to not to interrupt your current cancer treatment. So just wanted to share with you briefly. If you have any quick questions regarding the integrated oncology approach, you can put in a chat box or just speak up, please. Thank you for your time.
Thank you, Dr. Umeda. Does anyone have any questions from any of us presenters? All right. Well, if we don't have any questions, I'm going to share my last slide with the QR code. All right, so thank you for participating today. And if you'd please take a moment to complete the program evaluation, your feedback is greatly appreciated. Thank you everyone for joining, and thank you Chef Gabby and Chef Jim and Dr. Umeda for presenting.
Thank you.
Thank you, everybody.
Take care.
Bye-bye.
Bye-bye.